We are very glad to have you here. Michelle Newby, PhD student at University of Newcastle, Australia.
Yes, thank you. Thank you, Gunilla, for inviting me up here at the last minute. I just wanted to say that what I've done, last night I quickly went back to the hotel room and tried to pull some things together. About 2 weeks ago I was in London presenting some work that I'm doing at the Royal College of Occupational Therapy conference. So I have kind of used that presentation and I hope that it's relevant. I've adapted it to try and make it relevant to this audience, but that's what I'm doing. So I'm going to talk to you today about a few different things, but primarily I'm going to talk to you about a scoping review that I'm doing as a part of my PhD, looking at PANDAS and occupational performance and what we know so far. And I just want to acknowledge my co-authors on this piece. Professor Shelley Lang, she's conjoint at University of Newcastle and she's also Program Director at Colorado State University. Dr. Kirsty Harrich at University of Newcastle and Associate Professor Janice Toner from Buffalo. So I wanted to talk first about occupational therapy because many people don't actually know what occupational therapy is. It's a bit of an obscure profession. So I just wanted to sort of define what it is, and that will help you to understand the work that I'm presenting today. So occupational therapists, we are allied health professionals. So we're a supportive profession. And we are primarily interested in enabling participation and independence in clients. And when there's an interruption in participation in independence, that's when you can engage an occupational therapist. So what we look quite closely at is what we call the occupational performance areas. So there are 4 key areas that we look at. First of all, we look at self-care. So we look at how is an individual participating in their morning routine. Can they get themselves out of bed? Can they get themselves dressed, do their teeth, eat, and carry out all those activities, keep themselves organised through that routine. We also look at, and a big part of this in the paediatric field is play and leisure. Play is the primary occupation of childhood, and play is where all the foundational skills for life are bedded down. So this is a big area that we look at. And we look at things like free play, but we also look at more organised play. So things like, can the child participate easily in organised sports? If they want to play soccer, can they do that? Can they ride a bike? Can they do all those normal childhood play and leisure occupations? We also look at school participation. So is the child, in context of PANDAS, can the child separate easily from the parent to attend school to begin with? When they're at school, can they sit and pay attention to the teacher for long enough to learn? Can they still their bodies to learn? Can they write? Are they able to organise their bookwork? Can they participate in playground activities? Are they able to socialise with their peers appropriately in that context? We also look quite closely at rest and sleep. And rest is a big one because a lot of the children that come into our clinic and a lot of children who have PANDAS and their exacerbations, they often have trouble stilling their body and having that mindful moment. So we look a lot at being able to still your body, to be still, to be able to focus to learn, or to be able to engage mindfully in the moment. In sleep, so getting to sleep easily and being able to sustain sleep. So if we've identified that there's a disruption in any of these key performance areas, we then start to dig a little bit deeper to find out what is causing that disruption. So what we will do is we have various standardised assessments that we might use, or we might use specific observational assessments to look at whether there's a biomechanical cause for the issue, whether there are sensory issues, and sensory is a very big deal for kids with PANDAS. We look at cognition, we look at a child's motivation and confidence. So is that a disruption to their ability to perform, to participate and to develop independence? And we also look at their social skills. So you can see that we're a very holistic profession. We look quite broadly over the child's day. We also take into consideration the environmental and the spiritual and cultural context that the child lives in and how that enables or otherwise their participation in independence. And so where do we fit? When we're thinking about PANDS, because we're here to talk about PANDS, where does occupational therapy fit? Well, we know from the treatment guidelines that it's a triad, really, isn't it? So it's the immunomodulatory therapies, antimicrobial, and there's the psychiatric, behavioural and supportive interventions. And we fit very much within the behavioural supportive intervention realm. And what I just wanted to say about that is that a lot of doctors, so I see a lot of clients in my clinic who have PANDS, and what doctors are telling them is that you just need to go and use some CBT. You need to go and learn CBT, and CBT is wonderful, and it is an evidence-based protocol for OCD, and it works beautifully. But when you have children, and Dr. Chang touched on it yesterday, when you have children who are acutely ill with PANDS, in a flare, CBT is really, really, really hard for them to access. So as professionals, for all the medical people out there, I really urge you to just think a little bit more broadly about what other allied health professionals can help these children during those exacerbations when they can't access cognitive therapies like CBT. And I'm a bit biased, but I put my hand up and I say that occupational therapy can really help because we have a strong foundation in sensory processing and sensory supportive interventions. And sensory interventions, I spoke to families yesterday about it, but it's a body-based intervention. You don't have to do any thinking. It's a body-based intervention and it can work to help children to be more calm and organised. I'll hop off my soapbox. So what I want to talk to you today about is it's the first part of my PhD. I'm 18 months into my PhD and I have started with a scoping review to map out what is currently known about the relationship between PANDS and occupational performance. So I'm using a scoping review because there's not enough literature out there to do a systematic review, and I'm using Levac's framework to guide me. And these were the key search terms. I'm not going to go through them all, but you can see that we looked at the diagnostic group and all of the different names that it has gone by in the past, the population, and then some key terms around the occupational performance outcomes. We looked at 7 different databases and we wanted to cast a wide net because PANDS publications are published quite broadly across the education, across the biomedical, across psychology and across nursing and allied health. So we cast a broad net. And you can see here in this PRISMA flow diagram that once we removed all the duplicates, we retrieved 1,473 articles, which I went through painstakingly every single one of them. And it's quite interesting because when you're searching PANDS, you come up with all sorts of things about, pots and pans and panda bears in China. So I had to get rid of all of those and I was able to filter it down to 19. So we included 19 articles in this scoping review. One of the other authors and I then went through a data extraction process where we extracted some key information from each of the articles. And then we undertook a thematic analysis to sort of look at the themes that were coming out. I used the Occupational Performance Model Australia, which was the model that I actually showed you at the very beginning to explain what occupational therapy is, to guide my initial coding of the information. And then within that I took an inductive approach where I kind of looked at the different themes within and across those areas. What I found within the 19 articles was that only 14 of them were primary data, the rest of them were descriptive. Out of the primary data articles, 5 of them were single case studies. 2 of them were conference abstracts that didn't have, there was no paper attached to that conference abstract. 2 of the 19 were occupational therapy specific publications, but only 1 of those was primary data. So there's a paucity of pure occupational therapy literature in this area. So just looking at the thematic analysis across the areas, we can see, so these are preliminary findings, we're finalising this analysis. We don't envisage that there'll be any changes to this, however. So what we can see is that within productivity, these children have significant issues with school attendance and school participation. They have troubles with handwriting, and we've talked about this, other speakers have spoken about it. It can be quite remarkable to see a child who has very, very legible and neat, easily readable handwriting at 9 years old, and then they have a flare and suddenly they are completely dysgraphic, and that's what the literature is talking about. They have troubles with homework, and they have a lot of troubles with maths. So this is coming out quite frequently, that maths can be quite difficult. And I can speak to that personally. I know that with my son, he's very gifted with maths, but as soon as he has a PANDAS flare, he can't do simple addition. So it's quite an interesting phenomenon. In terms of play and leisure, there was not a lot written about that, and I think that just speaks to the paucity of literature out there. But what is out there is that they do have difficulties participating and accessing typical extracurricular activities. And there was an article that talked about, two articles that talked about students who had gone on holiday camps and one was taken to hospital and another one was sent home. So they're not able to participate in these typical daily activities of childhood. In terms of self-maintenance, the effect was quite profound. We know that they have problems with food restriction and eating, getting dressed, toileting, managing their own personal hygiene and grooming. They become very dependent on their caregivers, and that adds in again to that caregiver burden. In terms of rest and sleep, we see a lot of bedtime fears and a lot of bedtime rituals. They have sleep problems, and they're not able to access mindfulness or relaxation. So we can see that it's pervasive across all of the key performance areas. And if we dig a little deeper down into the performance components, we can see that within the biomechanical component, these children, they have trouble with elimination. So they have the urinary frequency. They often have fine motor difficulties. So, these children who used to be able to tie laces can now no longer tie their laces or hold a pencil. They have gross motor problems. They talk about pain, and Dr. Frankovic spoke about that yesterday. There's reports of unusual movements, and so that's tics and also the career type movements, but also changes in their gait. And there's reports of weakness and fatigue as well. So quite significant biomechanical impairments that we can see. Within the cognitive realm, there is a severe decline in academic performance. So students, I've had children who come to me in clinic who have been A grade students who are now in special schools because they've been left untreated and various things. But it has a severe impact on a child's academic performance. Their executive function is impacted and their visual perception. In terms of sensory, we need more work around this definitely, but there is evidence that there are sensory processing challenges, and we see hyperactivity in these children. In terms of interpersonal skills, we see aggression and rage, communication challenges, separation anxiety and generalised anxiety, oppositional behaviours, and challenges with social and peer participation. And in terms of intrapersonal, they have challenges with mood, anxiety and irrational fears, behaviour changes, problems with insight, issues with self-regulation, and this is huge. We see a huge number of children with PANDAS who have self-regulation challenges, a social withdrawal, and also psychosis and self-harm. So just to discuss that, so we can see that PANDAS exacerbations are pervasive. They impact every single aspect of a child's life and all of their skill level. know is that there's a paucity of occupational therapy specific publications. So occupational therapists, we work with this, we work with across all of those areas, but we're not researching, we're not examining this specific population of children. And there are some research gaps, so we've identified that we need more standardised measures of occupational performance areas and components. So the article that looked at occupational performance in children with PANDAS, it was a researcher-developed questionnaire. So we believe that we need more standardised assessments to gauge the true level of impact. And we want to look more at the performance comparisons during and between exacerbations. So a lot of the research is talking about what's happening during exacerbations, but no one's really looking at what's happening between exacerbations. So given the impact that PANDAS exacerbations have across all areas of occupational performance, we can see that occupational therapists have a key role with this population group. But that more rigorous research is needed to examine the occupational performance challenges to better inform our practice. So, and that leads me to the next steps with my PhD. So what we're going to do is we are just in the final stages of our ethics approval, and we'll be starting to recruit for a study that we're doing. And what we're going to do is we're going to examine what are the differences in occupational performance in children with PANDAS during and between exacerbations, and we're going to be doing the same with sensory processing. So what are the differences in sensory processing during and between exacerbations? And in order to do that, we're going to be using these two specific tools. So the first one is the Vineland Adaptive Behaviour Scale, the VABS, and it examines daily living skills, socialisation and communication. And then we'll be using the sensory processing measure. Alongside that, we'll be looking at vision, hearing, touch, body awareness, and balance and motion. So that's to come. So these are my references. These are the articles that I included in my scoping. And I just wanted to, since I've got the stage and I have your attention, I just wanted to put a shout out. So what I found, so I was a parent, and I was getting support from, various parent support groups. But what I noticed is that there was nothing for therapists. And therapists were actually starting to join these parent groups. So I decided that I would actually set up a therapist group to try and increase the profile of PANDAS and provide a supportive environment for therapists to learn more about PANDAS. So if you are a therapist, please join. If you have a child who has a therapist, please tell your child's therapist about it. And if you work with a therapist, please tell your colleagues. Thank you.
When you are calling out for therapists, are there any specific therapists? Or
So occupational therapists, psychologists, social workers, speech therapists, so any of the allied health professionals and psychologists. Yeah, we want to sort of target. We've had some nutritional people want to come and join, but I kind of feel like the discussion is a bit different. So we want to keep it to that sort of developmental type allied health professional.
Yes.
Yeah.
And what was the very special therapy that you are using? I didn't really get it.
Yeah.
The one, yeah?
Sensory processing.
Okay.
And what we tend to use for children, who have PANDAS and they're in flares and they're displaying sensory challenges, we use what we call a sensory diet, and it needs to be an individualised and tailored sort of set of sensory activities that are designed for that child. And we target specific parts of the nervous system that help to calm and organise that child. So it's a body-based therapy, it's not a thinking therapy. So we target the tactile, the proprioceptive and the vestibular systems. And the parents in the room would have heard me speak about that yesterday. But if you target those sensory systems in a specific way for that individual child, it's not a magic wand, but it can be the difference between a child who is completely dysregulated and a child who can bring themselves back to a state of regulation. And we work very multidisciplinary, so we would never just use a sensory diet in isolation. You need to be treating the underlying cause of that exacerbation with your doctor, but a sensory diet can be a great tool to use alongside as well.
And are the parents, I suppose they need to be present as well?
Absolutely. So we have a family-centred model of practice, and we do like to empower children, and we do that as needed. But during times of exacerbation, it is the parent that is co-regulating with that child. And as part of that co-regulation process, they need to be aware of what kind of sensory tools that we might use and ways of being with the child.
Because this is quite a new way to approach the PANDAS children. But where can you find more information about this sensory therapy?
Occupational therapists, so most occupational therapists have sensory processing training, so paediatric occupational therapists. Otherwise, you can email me and I can sort of send you in the right direction. Most countries have a professional association of occupational therapists that can direct you to the right people.
Have you any notion about do you get support for this, or are you, on your own?
So occupational therapists working in the area are very skilled and very knowledgeable in this. So we have a lot of support within our own field. And I think that there are some doctors I know that, there are some doctors who are learning more about this and more supportive of this intervention. I know that a lot of my psychology colleagues back in Newcastle will refer into us for those sensory-based therapies when they believe that the cognitive therapies are not going to be as effective during those exacerbations. So we're raising the profile of this intervention. And it's a good opportunity here today to talk about that.
Yes, of course.
Yeah.
Thank you very much, and have a happy birthday.